Okay, we are live. All right, well, good evening, everyone. I am Jennifer Petty. I am Mrs. Atlanta America 2022. And okay, we are live. Yes, I'm just elated that you have decided to join us this evening for what we believe to be a very important conversation. Good evening, everyone. I am Jennifer Petty. I am Mrs. Atlanta America 2022. And I would be remiss if I didn't start by wishing everyone a happy Women's History Month. Decided to join us this evening for we know that behind every strong woman is a story that has caused her to be, right? And so I can certainly relate to that. I would be remiss if I didn't start by wishing everyone a happy Women's History Month. Decided to join us this evening for we know that behind every strong woman is a story that right? And so I can certainly relate to that. I would be remiss if I didn't start by wishing everyone a happy Women's History Month. Decided to join us this evening. Okay, we'll try this again. All right, good evening again, everyone. I am Jennifer Petty. I am Mrs. Atlanta 2022. I am elated that each of you have decided to take time and join us this evening for what we believe to be a very important conversation on maternal health. All right, good evening again, everyone. I am Jennifer Petty. I am Mrs. Atlanta 2022. So when I think about powerful women aligned with Women's History Month, and I think about moms in particular that have endured challenges and complications along the way. Like many of you, of course, I think about moms like Beyonce, right, or Serena Williams, but I also think about moms like Kira Johnson and Dr. Shalon Irving, who are no longer here. And so we know that stories are powerful, all right? And so I really wanted to take an opportunity tonight and honor our stories, take time to recognize our stories, take time to learn from our stories, and take time to see and highlight opportunities for our stories to inform next steps to hopefully improve maternal health, not only here within the state of Georgia, but throughout the United States. For those who may not know me as well, I'm a legal epidemiologist. I am a health equity champion, proud wife, sister, daughter, I'm a niece, cousin, I am a soror, but I'm also a mom to a beautiful little girl named Jayla Ann Rose. She actually turns 1 tomorrow, believe it or not. Jason and I, we're not ready, but she turned 1. And there was a time where we did not know whether I would be around to see her 1-year birthday. And this is because I'm a near miss survivor, meaning that shortly after Jayla was born, I had complications that were life-threatening. And so I know that I am one of thousands, I think as many as 60,000 moms this year alone that have experienced this type of near miss experience. And that's too many moms, right? We know that when we look at maternal mortality, we know that maternal mortality has worsened throughout the pandemic. We know that there are, I think, somewhere between 23 and 24 women or moms die for each 100,000 live childbirth. We know that that number was more than double for Black women. And when you look at the state of Georgia, Georgia is actually twice the national rate when it comes to maternal mortality. So for these reasons, it is imperative that we come together and really take time to address these issues and hopefully improve health outcomes for moms. So I am ecstatic that we have some amazing moms here this evening who have agreed to share their powerful stories with us. I will start with, we have Adrienne White, we have Beatrice, we have Tanil, we have Dr. Fleta Jackson, and we have Megan Flores. Dr. Jackson will actually be joining us a little later in the segment to share some of her thoughts around how we made it here and things that we can do to improve outcomes. So moms, if you would take the time to please introduce yourselves.
Sure. Good evening. My name is Adrienne White, and I am.
Please, Adrienne, I'm looking at you.
Okay. Good evening. My name is Adrienne White. I am the proud mother of Blue Spencer Cardin, and he is now 9.5 months old. And I'm super excited today. Long story that I won't share, but today we finally got a Social Security card, so he's a legal citizen, and we will now pay taxes on, or hopefully get tax benefits on him. But he's just been my life's biggest blessing. I'm an older mother. I turned 40 and then had him about 2 months later, and kind of gave up hope that I would have a child, but God had different plans, and I'm just so grateful that he's in my world. So yeah, that's me in a nutshell.
Hi, everyone. I'm Beatrice Cotray. My little brown sugar baby is Gia. Stop, Gia. It's Gia. I am a first-time mom. I too did not think that I was going to be able to have any children. So I'm excited about this journey that I've been on with my little blessing.
Hi there, I'm Megan Flores. I'm actually a mom to 2 children, Spencer, who is now 5, and Macy, who is turning 2 in June. And I too am an older mom. Spencer was born when I was 38, I believe. And Macy was born when I was 41. And I actually had a miscarriage between the 2 of them. So I wasn't sure whether Macy would join us ever either, just because I felt like I was possibly too old to have a second pregnancy, but it all worked out and she's healthy and perfect.
Yes, I can attest that all of y'all's kids are perfect.
Well, hi, my name is Tanil Hodge, and I'm a boy mom. I have 2 boys. I have a 6-year-old and a 1-year-old. I am considered a young mom. I had my first son, when I was 18, and my son now when I was 24. Sorry, y'all. I have mommy brain, so I'm trying to just keep it together.
All right. Well, thank you all for being here. I really appreciate not only you taking your time, but your transparency. So with that being said, if each of you could first share something that you really enjoyed about your birthing experience during your pregnancy, your delivery and or postpartum phase, but just something that for you was something that you just really enjoyed the most.
I enjoyed.
Well,
Go ahead.
I was gonna say, I didn't really start enjoying the process until she was actually here. But I just enjoyed just watching her grow and her growing into her little personality. I love being her mother. Like, I didn't think that I could feel so much fulfillment from one thing, from one person. And she has just given me so much. So that's what I've been enjoying, just watching her grow and coming into her own little personality. So that's what I've enjoyed.
I would say I enjoyed kind of the strength and calmness that being pregnant really forced me to take on. I was kind of going through a career challenge, and I'm a type A. I'm highly anxious, and I usually allow kind of this anxious energy to flow through my body. And when I became pregnant, it became super important to me that I really only allow positive, good energy to flow through my body, given that it wasn't just me at this point. And that was a tremendous point of growth, because even now, I feel like I have the ability to remain much more calm in the face of just obstacles. And I don't think I would have had that that kind of inner peace had I not been pregnant with Blue and been forced to think about, how just my natural energy impacts somebody other than me. So that was incredibly rewarding, and that's a part of the pregnancy process that I really enjoyed.
Megan, to know.
What I would say that I enjoyed about my pregnancies was, well, with my first child, I was young. So it was just the fact of like seeing and being able to feel a human like growing. Like it was like weird to me, even though it's natural. Like with both my sons, it was still weird with my second son that like my body can create another child and it doesn't just seem like effortlessly. I know also with my 1-year-old, something else I enjoyed with him is that I was able to breastfeed for as long as I did. Like I'm still breastfeeding him and he's 1. And for me, that I feel like that was a complete like eye opener for me, because I was under the impression that I probably wouldn't be able to breastfeed him because I wasn't able to do it with my son, and that I want to be able to share that connection with him. And it's just, even with a 1-year-old and still breastfeeding my 1-year-old, it's still just mind-boggling the connection that you can have with your kids, regardless if they're breastfed or formula fed. It's just like they're like, they come from you and they share the same energy, they share the same love. And I think that is what I enjoy about being a mom.
I was not a person who really enjoyed being pregnant either time, if I'm being perfectly honest about it. I also, I would say in my first pregnancy, I had trouble feeling a connection to, being pregnant and, a connection to my baby before my baby was born. But as part of the birthing process, I actually really did enjoy seeing my husband. I didn't know what to expect, and he was a great source. He was also that way during my pregnancy. I shouldn't say that. He was wonderful, and he continues to be now. But I think really I think I expected him to be more squeamish than he was. And I was very proud of him when he proved to not be at all. So, and I, postpartum, I would say I really did appreciate all the support of my family and friends, in addition to just being just so in love with my little people after they joined us.
Amazing. Would you say that your birth experiences aligned with your expectations? Did you have expectations?
I didn't have any either. I mean, not the first time at least. And then with Macy, well, both times I guess I had some surprises. So the first time I got an epidural, and I thought the epidural didn't work very well. And by the time I went into active labor. I thought it was very painful, but I learned the second time around that the first time was nothing. It was not painful at all, because the second time my epidural did not really work at all. And I became this just moaning, like, I think David probably thought I was possessed. I think he was really surprised that time, but he kept his cool. So, but no, I didn't really have any expectations. So I can't say whether that, it did or didn't meet them. I guess I expected the epidural to work, and that did not bear itself out.
Mine did not go as planned. I was over the top after a certain point. Like, I had my birthing plan, I had my notebook, and nothing went according to what I had set out in my notebook. The labor, I was expecting it to go pretty quickly, but it did not. I was in labor for like 16 hours. My epidural kept wearing off. So it was horrible. And I was having a hard time with being heard about what I was feeling while I was at the hospital. So it definitely didn't go as planned. And then I had some complications afterwards, and she was having some issues. Like, it was like back and forth, but she ended up being perfect. So
sure.
I'm happy about that.
Can you talk to me a little more about not being heard?
Okay, so, and that started from when I found out I was pregnant until even now. So initially I started developing really bad pelvic pain and back pain. I couldn't sleep, and I was about 13 weeks, and they kept saying, well, it's too soon for you to be feeling pain. And it just, as the pregnancy went on, it just got worse and worse and worse. So, and another thing, I kept asking for Black providers. Like, I didn't have anything against white providers, but statistically, Black women have more successful pregnancies when their providers look like them. And because I was high risk, because of my medical history, and because I had already suffered from multiple miscarriages, I was trying to be extremely cautious and careful and planned out for this pregnancy. So it took a while for me to actually even get a Black provider. And it wasn't until, and I kept asking about referrals for the pain. It wasn't until I was 22 weeks that they actually got me a referral, and I actually was transferred to a Black provider. I got my referral and was able to start physical therapy. So it turns out my concerns were not invalid. Like, I was having pain, and I developed SPD early on, and that's symphysis dysfunction, symphysis pelvic dysfunction. So it's when your body produces relaxin too soon. So I was miserable. My body was literally feeling like it was splitting in half the bigger she got. And they just kept telling me that it's too soon for you to feel this way. And now I'm still dealing with it, because the key to getting SPD cured is to get treatment soon rather than later. So I was in pain for an additional 2 months after I started complaining before I actually got any help, and I'm still dealing with it.
Well, I know that not being heard is a big issue, and it's something that happened to me as well. And I work in public health, right? And so if I'm not heard, right, it's kind of like, who else can attest to the same. So.
I didn't have too many expectations about the process. I mean, I stayed with I initially thought I was going to look for a Black OBGYN, but I had a myomectomy about 10 years prior, and my doctor who did that surgery I decided to stick with him since he knew my body, he knew my history. So so yeah, I stuck with him, and I think that was a good experience. If y'all had a baby in the last 2 years, you kind of appreciate how sometimes lonely the process felt because your partner could not go with you to the doctor visits. And so quite honestly, I think for some of the men, it probably took them a little bit longer to feel bonded as well. Although I want to shout out, who is it? Hey Baby Boutique and old Little 5 Points. I went there with Kirkland, and it's just a vanity ultrasound, and they do a great job. And so Kirkland saw the baby and was like, "Oh, I did that." It's like, yes, you did. Um, but kind of this bigger thought that I had right before getting pregnant, I was kind of obsessed with my family history, and having learned about ancestry.com, I just discovered that my great 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 grandmother had nearly 14 children in the late 1800s, early 1900s. And so honestly, that provided me with an immense sense of comfort, because I just thought, if she can do it with a lot less resource, by golly, I can get through this. And I think the only real surprise along the way was, and I'm a very healthy woman, I had launched Black Girls Run in Atlanta. Running and triathlons had been my thing prior to pregnancy. And I developed gestational diabetes. So that made kind of that last trimester less than awesome. But in retrospect, I'm a little bit grateful, because I think not kind of having this license to eat whatever I wanted kind of kept me in check. And then the birth experience, we scheduled his birth date well in advance, because like I mentioned, I had a myomectomy, and the recommendation was to have a C-section, because I had already had scarring on my uterus from the previous surgery. And I just felt relatively comfortable going into the process. And really, everything kind of happened as planned.
I know for me, I with my first son, my 6-year-old, I expected what you see in the movies. I expected me to go to full term. I expected for me to be out or with my family, and then my water breaks, and oh my gosh, let's rush to the hospital. And then, oh, the baby's coming, and to be there for a long period of time and get an epidural, and just like I expected all like to be able to go through all the motions with labor. And with both my sons, I labored fast. With my first son, my water didn't break until after I was literally about to push. Um, I had him in 4 hours. I had my second son in an hour and 20 something minutes. And I guess that's what I just was expecting to do, the storybook laboring. I also expected because it was my second time around, because with my first child, I didn't know much. But with my second child, I anticipated I was going to maybe have this baby early, and that I was going to have my baby fast. But like what most people do is by like as an accident, we compare our pregnancies. I was like, oh, well, I had my first son at 36 weeks. I'm going to have my next child at 36 weeks. I know it. I didn't have my second son until I was 39 weeks. So when I'm thinking, wow, what is wrong with my body right now? Because my body didn't do this with the last one. My last baby, I had him 36 weeks. What's going on? So then you go into then for me, I didn't want to be induced. I was being told that if I didn't make it before my due date, that on my due date, they were going to schedule an induction. So with that, I'm like, oh, well, I don't want an induction. So let me try and do natural remedies to speed up my labor, make me go into labor. So I feel like with me, my expectation was to believe that both pregnancies was going to be the same and that I was going to be able to control everything with my pregnancy, knowing that I was knowledgeable, but not knowing that in that state of vulnerability, you can't control everything. You're not going to be able to, you know, in most instances, stand up for yourself and say, no, I want this, or no, I don't want to do that. So like, I can understand when with you guys saying that, you know, being not heard, but you're expecting because you're in a state of vulnerability and that you're, you know, are surrounded by groups of medical providers that they would listen to you and they wouldn't try to, you know, basically steer what you want, that they would listen to you. So that's what I was expecting, for me to be able to control the situation for the most part.
Sure. And Tanil, I think you are unique amongst the moms on this panel because you have a child that was born before the COVID-19 pandemic, and then you also have a pandemic baby. So could you talk to us about how you feel, if at all, the pandemic impacted your, I guess, most recent delivery as opposed to the first one?
I feel like with my most recent delivery, even though I had a baby already, I was just really nervous. I didn't have my support system. I wasn't able to have my mom in the room or have my dad or my sister. You know, I had my boyfriend in the room and he was just as scared as I was. So how could you comfort me if you need comfort? So that's what I missed with I missed the ability to have my village or my support system surround me and provide me with the strength that I needed. I also miss, I know that a lot of people say, oh, I want to just have my baby and I don't want anybody to come. I missed having visitors because being in a maternity ward, majority of the time, you're not seeing other people other than your baby. And then for weeks or months at a time, depending on how long you're out of work, all you're seeing is your baby. So then now you feel like you have baby brain. Like all I do is talk to my baby that doesn't talk back to me, yells and screams at me, or he wants to eat. So I have to feed him. Oh, he doesn't want to go to sleep. So I have to be up with him. You just kind of miss that ability to like communicate with adults for the most part. I miss that.
I understand. Given what you all have shared, you know, in some instances about, you know, the epidural or gestational diabetes, not being heard, not having the support system that you felt that you needed during that time, what would you leave with moms this evening? Advice, recommendations, resources, what would you leave with moms? Something that you feel would have been helpful to you. So whether it's to moms as well as future moms who may be tuning in to this conversation.
I would say I would leave with that you know your body better than anyone. You know your feelings better than anyone. You know your partner better than anyone. And so does your partner. They know you better than anyone. And I feel that with knowing that, you have to be your own advocate just as much as your partner is your advocate. Just like if you have a birth plan or you know how you want your birth to go, you should explain that with your partner. You should let your partner know. You should also do your research because birth is not just cut and dry. You're not gonna get the same labor or the same birth every time. Different things happen. And if you educate yourself and you are aware of the multiple things that could go wrong or the multiple things that is normal, then you'll be able to catch what is abnormal and you'll be able to say, well, no, I have the right to say, I don't want to do this. And I have the right to say that I can do this. So you won't feel like you are being bullied or coerced to do anything that you don't feel is right or you don't have in your birth plan. That would be my advice.
My advice would be to, and it can be difficult, but try to build a community of women who are going through the same thing at approximately the same time. Because of course we all have friends who have had kids before us, and that will come after us. But I created a community of other women who had had babies within 6 months on either side of me, and just for that kind of in the moment gut check, like, hey, this seems unusual. Are you experiencing the same thing? It was extremely comforting to me. It's not necessarily kind of the more medical type of advice, but pregnancy is just as much emotional and mental as it is truly physical. So having a support system of women who are going through something similar was so important to me.
And I'll just jump in and say thank you, Adrienne, for creating that group, because I'm a part of that group as well. And you have no idea how much I reference the topics and kind of what moms are doing. And it's really been helpful to Jason and me. So thank you.
I would say focus heavily on self-care, especially before you have the baby. I think that was something that I wish that I had spent more time with, as far as like caring for myself and, just spending that time for myself, because when the baby gets here, people really do forget about you. They forget about you. And, people call in like, how's the baby? The first thing they say is, how's the baby, or what the baby's doing? And then they forget to ask about you. So I think that it's important to take self-care, remember how important you are and how valued you are, because the baby can't be okay if you're not okay. So I think that, spending that time, and even afterwards, like just taking a moment to yourself, like even if, like, it's like, for instance, she had a lot going on. She had colic and all that stuff. So I was overwhelmed, and I ended up, I'm still dealing with postpartum depression, but it was important for me to just take a moment, like to say, Gia, she's screaming, but I said, Gia, mommy needs about 5 minutes. I'm going to leave you right here. I'll be right back. And I would just go in the bathroom and like cry. Like, so that would be another thing. Don't hold it in, just let it out. Let it out. So just take that 5 minutes, cry it out, suck it up, come back in. Okay, baby, what's wrong? How can mommy help? So self-care, cry it out, take that time.
I guess I would say maybe don't try and be a martyr, because I am a person that suffers from anxiety, and before my first child was born, I went off all the medications that I had, and it actually was fine while I was pregnant. I think the relaxin just kind of helped calm my nervous system, but after I gave birth and I wasn't sleeping, I had horrible anxiety, and it made things a lot more difficult than I think they needed to be. I slept a lot less than I probably could have. And there came a point after my son was born where I went back on medication, and then I stayed on it through my second pregnancy. And I felt like my experience the second time was healthier in some ways, from like a mental and emotional standpoint. Probably even through the pregnancy was a little bit better than the first time around, but then postpartum it was considerably better. Both my children, beautiful, perfect, no health issues, intelligent, and I think a lot of women are scared to take medication. And I just feel like I was just a healthier wife and mother through my second pregnancy because I made different decisions the second time around.
Sure. I just want to say thank you, Adrienne, Megan, B, Tanil, for sharing a part of your experience with us tonight. Really appreciate your transparency. I am confident that this will be helpful to moms and future moms, as well as support systems who have decided to tune in this evening. So thank you so much. I really appreciate it. I want to take a few minutes to talk with Dr. Fleta Mass Jackson now. Dr. Jackson is a renowned maternal health expert that I'm sure many of you tuned in tonight are familiar with. She has done so many, led so many amazing initiatives in this area. And I feel really, I'm excited that she has made the time to join us this evening. But let me just throw in addition to her resume, she is also a dear friend of mine and church member, and someone who was always a phone call away during my pregnancy and postpartum experience. And, I mentioned earlier that my daughter turns 1 tomorrow, right? This day last year, I was actually in a hospital room. Had no idea that my daughter would be born that next morning. And I was actually moderating a women's health panel that night. But no, most people had no idea that I was in the hospital because I had a Women's History Month background on my Zoom. And Dr. Jackson was texting me frenetically saying, get off of Zoom. I will take over this discussion. Please go to bed. Please lie down. And she was so concerned. And in all honesty, in that moment, I could not understand your level of concern. I couldn't comprehend why you were so concerned or that sense of urgency. But about a year later, I get it. Okay. I get it. And so I want to publicly just say thank you. Thank you for being that person and continuing to be that person. So with that being said, Dr. Jackson, if you could please kind of just introduce yourself.
Yes, it is just a pleasure and honor to be with everyone this afternoon. And I loved hearing your stories for this generation of mothers. I too am a mother. I have 2 children. My first child was born in 1977, and my second child was born in 1991. Wow, what a difference. And I'm the mother of both of those children. So I am their mother. And, when I listen to your birth stories, I couldn't help but think of my own. In 1977, if we looked at infant mortality in this country, in particular Black infant mortality, we saw that there was at least closing of the gap. Black babies are twice as likely to have adverse birth outcomes, which can lead to premature death. But in 1977, something happened. And those who've done the research would say that there was at least a promise of equity in this country. And that promise of equity helped to socially determine things because we bring our whole selves to pregnancy. So it's not just the baby that we're carrying, but the future that we hold for those children. And so we could say that in that time, 1977, I'm Black and I'm proud, but it wasn't just that there were jobs and there was housing, there were a lot of things that were going on. And for me, I recognized that my daughter was born in what was called a birthing room. That was a new concept. And a birthing room was actually something where you had the hospital bed, the rocking chair, a more relaxed, less clinical environment, and a midwife attended me. And I didn't really realize that until the doctor who I had been going to, he came late. She had already done the work. The baby was born, but it was a different kind of experience. Now, fast forward to 1991, 2 years before that, I miscarried. And then in 1991, I had a C-section with a big boy, and that was totally clinical. So I look at just what were the differences in it. One of the things I want to say, we give so much attention to maternal mortality as we should. No life should be needlessly lost. And if I had the chart here, you would see the United States has the highest rates of maternal mortality in the world among developed countries. Unacceptable. We invest more money. We have research, as Jennifer said, She is in this arena, and she's worked at CDC. So she knows the kind of research and innovation that has gone on in terms of medicine in this country. So it's really no excuse for women to die needlessly. It just is inexcusable. Or for them to come to near misses when we really do have the know-how. We really know how. It's will, but having the way is different from not having the will. And this is a matter of will, not way. There are different things here. And so we are at this juncture. Fortunately, most women have healthy babies. You know, and I have to say that because I had a physician say to me, her patient came in, had high anxiety. The doctor said, "What's wrong?" She said, "Well, I don't want to die." And she said, "What do you mean you don't want to die?" Well, people are dying from having babies. So that message, we've got to balance that a little more. It is a matter of not wanting anybody needlessly to die, but not that pregnancy is a death sentence. And, you know, we have this kind of thing where people will say, "Oh, pregnancy is the closest thing to dying." Well, I remember labor pains, and I did think about what if I jumped out of this window? Yes, but I thought about it for a minute. I confess to you, but it really was not death. It really was not death. It was a transitioning moment with a good outcome at the end. But I think we have to be really careful about our balancing our message about maternal mortality. Now, that said, there are so many wonderful things that are happening now, thanks to the advocacy of different groups that I am aware of. March of Dimes has really stepped up its game in this arena. And I know, Jennifer, you work with March of Dimes in terms of looking at so many things to make sure that the expectant mothers and people have everything that they need in a way, that they are involved with. How do you train the providers to hear you? You know, and so don't give up, B, on this. I will say to you that there are some things that are happening in terms of quality improvement and training that we will see in years to come that will change that birth experience, because that is really, really being done. I did a presentation the other day for maternal and child health bureaus in Nebraska, Ohio, Indianapolis, Massachusetts, and Mississippi. And so they're part of a learning group that is charged with looking at making sure that there's nothing that's going on that's inequitable, but also that they really are trained in terms of what to look for, what to hear, and what to respond to. That's happening all over the country now. And so I do expect for them to be tangible outcomes in terms of the way, the interaction. But it does mean as expectant mothers have to demand that they get to that. So B, don't give up. You know, you have the option of finding other providers, and they are in this city. And that's the other thing. There are apps that are being developed that are rating providers, where you can go in and say, now, how do they rate? What did patients, clients say about these individuals? That's happening. The mental health. I work in the maternal mental health area, and it's not something that we have really automatically included. And thank you so much, Megan, for talking about the medication, you know, to know that it's okay. And with the supervision of your doctor, for you to really go through that process and not be anxious and reduce your depression and what have you. Yes. And we are giving more attention to that because mental health is one of the risk factors for maternal mortality, for women dying, whether it's suicide, and that's really a horrible thing for us to think about, whether it's suicide or other kind of manifestations, because depression is a physiological as well as a mental condition. And it also, there can have risk for other things, cardiovascular disease and so forth. So we're in a good time, in my view, having been in this over 20 years and looking at the progression of what is the movement around making sure there's equitable care no matter who a woman is, no matter what her language is, what her race is, what her culture is, that she gets what she needs for her and the baby to get to the finish line and beyond. We moved into health insurance in terms of Medicaid that goes from 6 months for women who don't have a private insurance, goes from 6 months to 12 months. And what's going to happen in that time? You know, this is what has been the organizing of what services does she get provided. We're moving away from just saying 6 weeks and done. So I'm with a group of people saying, no, 2 weeks, you see your doctor, 6 weeks maybe, but then there's a 6 month and some other times, because if you provide that care coverage, then you have to have some standards and some benchmarks to make sure so that you don't lose, because sometimes what happens is, let's see, one of your speakers talked about gestational diabetes. We have to make sure we monitor that. That's not, that could be the end or the beginning. And so that there are standards for that are being reevaluated in terms of what happens. So I would say to you, share your stories. I liked what was said about having a care team. And as you said, Jennifer, your cohorts. It's important that you have people whom you talk to who are going through this. We've had a care model that we call centering, where individuals who are pregnant around the same time get together and share what's going on. But informally, to have individuals so say, oh, what's that? Loneliness is a real issue. And I'm sure during this COVID, it has certainly created major kinds of risk for individuals who otherwise may have been in a setting where they could get with others to really share, but could not do it. Now, on the other hand, the COVID has also created the possibility for the very way that we are communicating. We don't know how effective it has been in terms of visits that could be online, but there are individuals who say, you know, I have this little baby, maybe it would be good for us to do an online visit. I don't think exclusively, but it does offer opportunities. So what I will say to the audience that's out there listening, yes, we do have an issue. And yes, it's unacceptable because we have the ways. Do we have the will is the question I ask. But I do think that we are at a moment in time where there are conversations like the one that's being had here, and conversation sharing that's happening everywhere, quite frankly, that didn't happen, say, 15 years ago, because the focus was on the baby and not necessarily the mother. And that's important, that we now, that individuals across this country are giving voice to those experiences, and giving voice to those experiences to inform and to advance and to advocate for policies in the care that is received, and the resources that are provided, and the support that individuals have, and better birth outcomes for everybody.
Thank you so much, Dr. Jackson. We actually have a question that I will present to you.
Okay.
I think it's Aiken. Aiken asks, he said his wife is new to the Atlanta area. She does not have a support system here, and wants to know whether there are any maternity support groups that you can recommend.
Not offhand, but I would say be in touch with places like the March of Dimes, be in touch with places like, I'm going to start out with the March of Dimes as a possible place to see if there are organized groups that have not been or that have been formed. I cannot think of one per se, but that to me seems to me a place to start, because they do have things that are set in place around emotional support for all women during and after pregnancy. And I don't know what you think about that, Jennifer, in terms of places.
Sure, no, that sounds great. And Aiken, if you want, if you send a message to the page, our page, we will shoot you the contact information and get you aligned with the appropriate.
And there's the postpartum support, postpartum support, which also has resources for mental health support, but also may well have groups that have been developed within them. So that's another resource that I'm aware of and that I know will provide quality services for individuals.
So definitely.
I don't know what you think about this, Dr. Jackson, but I gave birth at Piedmont Hospital, and I believe that they had both, they organized support groups both during pregnancy and postpartum. And they also had a lot of classes, educational classes, which provide opportunities for that as well.
Yes, yes. And that's a very good suggestion. And many of the hospitals do that. So I'm aware of the one at Piedmont. And I know at DeKalb Hospital, their women and maternal health does have some those opportunities as well.
Sure. Thank you for that question, Aiken, and please send us that message so we can get you that contact information. All right, well, thank you so much, Dr. Jackson, per usual. Great information. Really appreciate you being here and being willing to share. Thank you again, Adrienne, Tanil, B, Megan. Really appreciate your time and your willingness to share. We will be discussing maternal health over the next few months. We hope that you will continue to join us. On April 11th, we will kick off kind of Black Maternal Health Week with a PSA about maternal health advocacy. On March 30th at 12 p.m., we will chat with Rose Horton, Executive Director for Women and Infant Services at Emory Hospital. She's also a White House appointee to their maternal mortality initiative. We will chat with CNN and MSNBC commentator and author Anousheh Hussain on April 14th, during which she will discuss her book, The Pain Gap. On April 19th, we will talk with attorney and United States bankruptcy trustee Jason Petty about navigating rising maternal health costs. On May 22nd, we will launch a PSA for Preeclampsia Awareness Day. And this can all be accessed using the very same link that was used for today's program. So thank you again for joining me. Thank you to my really good friend, Ivo Christopher, who has helped immensely with not only the planning, but with the advertising of tonight's initiative. Together, let's continue to improve health outcomes for mom. Until next time, stay safe and well. Thank you.
Bye-bye now.